Hey guys, it's your pal, Dr. Sal again. I hope your week is going terrific. Today's topic is Seroquel. So this is another antipsychotic that's been around for a long time, very effective for many uses beyond psychosis. To me, it's actually unfortunate that it's classified as an antipsychotic because I use it for more conditions that have nothing to do with psychosis than for psychosis. But anyway, the original indication was for heavy hitters like schizophrenia, mania, and bipolar. Starting dose is typically about 25 milligrams twice a day for those conditions. But as I just alluded to, I use it for many other things. I've used it successfully in patients for treatment as an adjunct or by itself for anxiety. I've used it for treating insomnia. Used it for PTSD, and the list goes on. So there's many other indications for it. I always hate that it's called an antipsychotic because it's always an awkward conversation when somebody asks me when I'm putting them on, and I tell them that, and then they immediately counter, well, they're not psychotic. And I say, yes, well, I know that, but it's just a misnomer. So anyway, let's get into it. The most common side effects if your physician is trying to prescribe you this for to help you with a mental challenge. So the study that we're looking at here was conducted on 449 patients. Now, what I'm going to do is split the side effects into those that were real and placebo. All right, so the most common side effect was headache. And that's true for many different medications. However, if you look at the actual incidence, the number of people that actually complained of it, it was only 20%, which seems like a lot, 1 in every 5 people. But on sugar pills, the guys in the placebo arm, 17% were also complaining of having a headache. So that to me tells me that the real incidence, most of it was literally in their head. Really only about 3% of people, or 3 in every 100, actually had a true bona fide headache as a consequence of this medication. The next big complaint on it was fatigue. And that one kind of makes sense to me because if you're trying to combat positive symptoms like anxiety, insomnia, schizophrenia, basically nervous systems that are restless and not calming down, well, you expect that if you're suppressing the neurology, if you get too much, it's going to cause fatigue as a spinoff. So that was complained of in 18% of users. And if we compare that to those on a sugar pill, placebo, it was 11%. So real incidence about 6 in every 100. Next up, and probably a lot more annoying, was dizziness. And that was complained of in 10% of users as opposed to 4% on a sugar pill who thought that they were on the real pill. So that spread there is about 6%, so not that common. Next up was postural drops. So that also will cause dizziness. What it means by postural drop is that when you get up suddenly from lying down or sitting, you suddenly feel your blood pressure drop, and we can actually measure that, which tends to cause dizziness. And as you'll notice, the complaints of that were 8%, as opposed to in placebo 2%, which gives you the same spread of 6. So it's very likely that this dizziness is really just postural blood pressure drops as a consequence of the medication. Mystery solved. The next common side effect was constipation. And the constipation was complained about in 9% of real users, as opposed to 5% in the control arm on placebos. So real incidence of about 4%, not really a deal breaker. Then the next one is dry mouth. Now, dry mouth might sound innocuous, but it can actually be very annoying if you suffer with it. So it's actually a bigger deal than it sounds. So that was complained of in 7% of users, as opposed to 2% of people taking a sugar pill. So real incidence is only 5 in every 100 people. So again, if it occurs to you, might be a deal breaker, you might need to switch to something else. But for most people, it's fairly well tolerated. And again, that 7% is probably going to be, 5% subtracted is probably just going to be in those people taking the highest doses. So typically when I'm using it for treatment of just anxiety or insomnia, I'm usually using smaller doses. You don't need as big a stick to treat something like that as you would for something like bipolar disorder or full-blown schizophrenia. One other thing to note, which you won't be able to see, but your prescriber will check, is liver strain. So we measure that. I'm not going to get into it, but there's two different angles we use. One is called AST and the other is ALT. They're two different enzymes that if the liver is getting punched, it will start squirting out into your serum and we can measure it. So the ALT, that was increased in 7% of patients as opposed to 2% in placebo. And the AST was increased in 4% as opposed to 1% on placebo. So in general, if you already suffer with liver failure or you're alcoholic or there's some other, you have cirrhosis or something of that nature, hepatitis C or something, you might want to steer away from this or be just very wary while you're on it. But your prescriber, if you bring it to their attention, can check this through serial enzymes, usually within 1 to 3 months after you start it and after any dose increase. If the numbers stay static, you're in the clear. So that, ladies and gentlemen, concludes an exploration of the most common, let me see, 1, 2, 3, 4, 5, the 6 most common side effects that one might experience when embarking on Seroquel treatment. Overall, I find it's usually very well tolerated and very effective. So thank you so much for watching. We'll be in touch again soon.
Thanks for watching. Get notified of new videos. Subscribe now.